trichotillomania. Trichotillomania is a long-term condition in which people pull their hair out. It may be on hand or head, in other places such as eyebrows or eyelash. This leads to bald patches called alopecia. Alopecia is basically a medical term to describe hair loss. Some people see trichotillomania as a type of addiction. The more you pull your hair out, the more addicted you are in it. Trichotillomania, for example, is also seen as a view of health problem. For example, as a way to seek temporary relief from emotional distress.
Hi, my name is Diana and I'm going to present to you all about the causes of trichotillomania, since I've chosen to write on the causes of that disease. Okay, and firstly, I would like to say that trichotillomania is evidence that it can run in families due to genetic causes, and it could also be caused by anxiety and stress, but researchers aren't really sure about it. Trichotillomania is a kind of disease where hair pulling is involved by the individual itself. It causes mild pain that hair pulling causes, leads to some type of good feeling that occurs of a chemical level. It also has calming effect on the nerves when someone does pull his or her hair. Another cause of suffering from trichotillomania could be obsessive compulsive disorder, which occurs when someone's obsessions lead them to developing habits to help them stop those thoughts, known as compulsions. As for some, hair pulling could be some type of addiction. The more they pull their hair out, the more they want to keep doing it. Trichotillomania most likely results from a combination of environmental and genetic factors. Abnormalities in the natural brain chemicals such as serotonin and dopamine might play a part of the disorder.
Today I'm going to present about the symptoms of trichotillomania. So before I present, I'm going to introduce myself. I'm Sweta from nursing batch 16. So, my first points of the symptoms of trichotillomania is they are like to wear short of cover, a hat, wig or a long sleeve shirts. So basically hair are typically pulled out from the scalp, eyebrow, eyelashes or other body areas. They are tend to perform other self-harming activities such as cutting or stabbing. So sometimes some of them like get sense of pleasure or relief after pulling their hair out. Okay, sometimes they will be chewing or eating the hair pull out, which is very disgusting. So sometimes if we heard about the trichotillomania disorder, we will feel sorry for them. So besides that, not only pulling the hair but also biting the skin, nails or lips. So other signs of trichotillomania are pulling the hair out from the clothes, blankets, dolls or even a pets. So some of them are believe that trichotillomania is a form of self-harm like cutting disorder and self-mutilation. So most instances are going to be related to stress and boredom. So when they feel like very stressed and boredom, they will do this trichotillomania disorder, which is pulling their hair out. So hair pulling can be a kind of addiction, and the more they pull the hair out, the more they wanted to keep doing it. So that's all for now, everyone. So like I hope you can gain some knowledge from this trichotillomania disorder. Thank you.
My name is Kirtika. I'm going to talk about the effects of trichotillomania. Although trichotillomania is a mental health disorder, it could lead to physical ramifications. The effects can also be debilitating. Trichotillomania may affect both physically and emotionally. The physical effects: folliculitis, which is the infection of the skin or hair root. It can also cause permanent hair loss. It is because of the repetitive disorder. When the hair regrows, it becomes coarser and curlier. The hair also changes color, hence the desire of pulling the hair becomes stronger. Next is repetitive stress injury. It can cause in the wrist because due to the pressure, when people pull their hair, it causes pressure here. So the skin, the tissue of the skin can tear. It also can become swollen. The next is carpal tunnel syndrome. Carpal tunnel syndrome is it's due to the compression of the median nerve. It can be caused because when pull the hair, it causes injury to the index finger, this finger, and the thumb. It can also cause the loosen of the grip.
Hello everyone, I'm Nini. I'm from Faculty of Nursing. Now I would like to talk about treatment for trichotillomania. One of it is comprehensive behavioral model, also known as COMB. In COMB, clinicians need to understand the function of hair pulling. For example, does it relieve stress? Does it end boredom or else? Does it reduce anger? Then, clinicians need to identify the type of hair pulling. Some people pull for sensory stimulation, or others due to specific thoughts like to get rid of grey hair. Lastly, clinicians need to give treatment that include all aspects of trichotillomania, including emotional regulation. By this, patients learn other ways of dealing with anger and stress. Patients' physical habits also need to be regulated. At the same time, reduce usage of environmental intervention like tweezers among patients. Next is dialectical behavioral therapy, that is DBT. Is also effective to treat trichotillomania at least 3 months. DBT is a form of cognitive behavioral therapy that focuses on learning new ways of regulating one's emotions. Additionally, behavioral therapy and emotional regulations are the most effective treatment for trichotillomania. Behavioral therapy not only works for adults, but it also helps for children as young as 7. For, for conclude, this most effective treatment includes 3 things. First, increase awareness of when, why, who, or where hair pulling occurs. Next, an effort to control or change hair pulling. Behavior need to be done. Lastly, is the emotional regulation training to find alternative way to dealing with negative feelings. Thank you.
About Trichotillomania organization. Trichotillomania is supported by the TLC Foundation, which help patients that are having rare disease such as trichotillomania, like I mentioned just now. Patient can also refer to genetic and rare disease called GARD, also known as GARD Center, which are specialized with doctors, nurses, and genetic counselors. There are a lot more of supporting organizations such as North American Hair Research Society called NAHRS, who are trying to create and maintain a database of hair disorder that will foster greater enhanced communication between bench, scene, even clinical, industry, and patients. Supporting groups online are also available. OCD Action, even Better Together project, where OCD is better understood and diagnosed quickly. Appropriate treatment options are open and access to information, and where nobody feels ashamed to ask for help.